Do you suffer from neck pain and sharp, tingling, or numb symptoms that radiate down one of your arms? Or maybe you have neck pain accompanied by some nagging, irritating symptoms between your shoulder blade and your spine. Sometimes patients say that it feels like it's under their shoulder blade. These are both common presentations for something called a cervical disc lesion, basically irritation or injury to one of the discs in your neck. I'm Dr. Connor Tobish with Whitefish Chiropractic, and this is another condition that we see all the time in the clinic, and we do really well treating it. So in this video, I want to explain a little bit of what these disc lesions actually are, why they happen, then we'll look at some assessment and some treatment techniques that we use to get these patients out of pain. So these cervical disc lesions can produce a variety of different symptoms. Like we said, a lot of times it starts with neck pain, and that can start to turn into symptoms between the shoulder blade and the spine, and eventually, if things go too far and it happens for long enough, we'll start to get some irritation or compression of the nerve that distributes into the arm. So a lot of times these patients will feel numbness, tingling, and even sharp superficial type pain that radiates down the arm. But what's actually causing these symptoms to happen? Well, a lot of times patients realize that their symptoms get worse after a long period of sitting, and really the driving force behind these injuries oftentimes is anterior head carriage, forward head posture, tech neck, whatever you like to call it. Basically a scenario where the head starts to get way out in front of the body. And what actually happens when our head starts to get too far out is we start to create imbalanced pressure on the disc. So here's my favorite teaching tool again, this little disc model. So again, in a perfect world, if these segments stay right above one another, that disc in between can share the load in a good balanced way. But oftentimes we start to get this anterior head carriage or this tech neck type of presentation. The further the head gets in front of the body and the longer that it stays there, the more we start to put some pressure on the front of the disc, and eventually something's got to give, and we'll start to push that disc material backwards until it actually blows through and creates some compression, irritating that nerve. When that happens, that's when we start to get the sharp symptoms going all the way down the arm. Initially, a lot of times we don't go all the way from here all the way to that full-blown disc going out the backside. A lot of times it starts as just a little bit of pressure creating some bulging of the disc material. The disc material will still be well maintained or well contained, but it is starting to push through those fibers that are trying to contain it. That creates some irritation and some inflammation. So initially, a lot of times it's just a little bulge with some inflammation that's creating your symptoms. And in those scenarios, those people are going to be feeling neck pain. They'll have those annoying nagging symptoms kind of between the shoulder blades. Sometimes they feel like they're under the shoulder blade. Like we said, if we stay there for too long or we keep this anterior head carriage presentation, eventually we'll get to a situation where the disc material can't be contained anymore, and it will push through the backside and create some irritation and compression of that nerve. That's when we're going to get the symptoms going down the arm. So now that we've talked a little bit about some of the symptoms associated with a cervical disc lesion, we're going to look at some of the testing that we do to assess and diagnose these lesions. The first thing that we're going to do is an orthopedic test called Sperling's test. So if he has a little bit of irritation to one of his discs, maybe it's compressing one of the nerves, if I bend his head towards that and compress it, we're probably going to get more pressure on that nerve, more pressure on the disc that's causing his problem. So if he's got a disc lesion on his right side up here in his cervical spine, if I tip his head this way and compress down, a lot of times that's going to reproduce his symptoms. So that's one orthopedic test that we commonly use to diagnose these disc lesions. The next thing that we'll do is a nerve tension test. If he's got some pressure pushing on one of those discs that's compressing into a nerve, if we take that nerve through its range of motion, a lot of times it's going to be stuck, and that's going to reproduce some of our symptoms. So we'll have him take his arm here. He's going to extend his arm out to the side and tip his head opposite, or tip his head over to the left. So if you imagine that nerve getting pulled in both directions right now, a lot of times if it's trapped up here in his neck, this is going to reproduce his symptoms down into his arm. So that's our nerve tension test that we use to diagnose these disc lesions. Another thing that we look at is these patients are going to have pain. They're also going to have reduced range of motion. So we'll do a mechanical assessment of his cervical spine. He may have pain bending left. He may have pain bending to the right. But a lot of times, like we said, these are produced by that tech neck or that anterior head carriage. So when we have him tuck his chin down to his chest, a lot of times this is going to push that disc material backwards. This is going to reproduce his symptoms. So he's not going to like that much. We'll have him extend back and look up at the ceiling. A lot of times patients are going to have a big discrepancy or a big reduction in range of motion going that way into extension. Because again, he's going to be extending those segments back, which may run into that disc material that's being bulged or being pushed backwards. So that's our mechanical assessment of the cervical spine. Okay, so now that we've looked at some of the things that we do to assess these disc lesions, now we're going to talk about some things that we do to treat them. So initially, if we can find his directional preference, or we can find a direction to move the segments in his cervical spine that reduces that disc bulge and reduces his symptoms, we're going to have him repetitively move his head in that direction. The majority of these disc lesions are going to be posterior, where the disc material is being pushed backwards. So to reduce that disc bulge, we're going to move his head in the position of retraction. So we're going to have him sit tall. We always say the head moves like a drawer, so it's not going to tip up, it's not going to tip down, it's just going to glide backwards. So he's basically going to be giving himself a double chin with a little bit of overpressure. So he'll demonstrate that real quick. He's going to let his chin glide backwards, then with one hand, just a little bit of extra pressure, getting those segments to their end range. The further we can move them into the right direction, the faster we're going to get where we're going. So we're going to send him home with his directional preference exercise. Every couple hours, we're going to have him do these retractions. And that's going to help us keep moving in the right direction even while he's out of the office. The next little exercise we're going to look at is a nerve glide. So again, you can basically think of the nerves of your body like little wires or ropes that run from your brain out to different parts of your body. So if he has a disc injury that's compressing one of those nerves that goes into his arm, we can work on pulling that nerve or gliding it out and in, and eventually we can work it free so that that nerve can move more freely down its trail. So for that, we're going to put him in a similar position to that nerve tension test that we did, where he's going to extend one arm out and tilt his head towards his hand. So if you imagine that nerve as a wire or a rope, when he goes this way and extends his hand backwards, he's pulling that rope down towards his hand. Then we'll have him bring the hand back in and tip his head away. Now he's pulling the nerve back towards his head. So we're flossing or gliding that nerve down its trail. And like we said, we'll be able to break it free and clean up that trail so it can move cleaner within it. The last thing that we're going to talk about is a little bit of cervical stabilization. Like we said, a lot of what causes these problems or drives them is going to be that anterior head carriage or tech neck, so the head getting out in front. The further the head gets out in front of the body, the harder these muscles in the back of your neck have to work to hold your head up. I always tell people, you don't think about it, but if you're driving with your head out in front of your body, these muscles are working hard. If they turned off, you'd hit your head on the steering wheel. So the harder these muscles have to work, the less all of these other muscles in our cervical spine are going to be contributing to stabilization. So to get these patients out of pain and make sure that they're good for a long time, we need to get these other muscles to start playing their role. So we're going to put him in a position to get these little muscles that are usually inhibited or underworking to start targeting them and plugging them back in so they can help stabilize his neck, so that if he has good stability all around his neck, his head will just basically hover above his shoulders, and obviously that's what we want. So we're going to have Mike go on his back, and we're going to show a deep neck flexion exercise. So we'll have him here. Like we said, we're trying to isolate and engage these deep muscles in the front of the neck. So we're going to have him tuck his chin down towards his chest, and then we're going to bring the head up just about an inch or an inch and a half off the back of the surface, and he's going to maintain this position. This is a sneaky hard exercise. So we're going to start working on doing this for longer periods. You can relax. We need these little muscles to have good endurance. So whether you're walking, running, sitting down, whatever the event is, we want these muscles all to be contributing to stabilization. So that's a great exercise to get better stability of the cervical spine and help these patients get better and stay better. So if you're suffering from neck pain, maybe you've got those symptoms shooting down your arm, or the irritating symptoms kind of under your shoulder blade or between the shoulder blade and the spine, give us a call today at 406-862-2121 or find us online at whitefishchiropracticcenter.com to book your appointment today. This is another one of the common conditions that we see every week, and we do great with it, and we'd love to help you. So give us a call or find us online. Thanks.